Oh, whatever. Okay.
Okay, all right, I'm gonna start. My name's Olivia,
I'm James.
My name's Frank.
And I'm Marlena.
and our presentation is on racism in the workplace. So, what is racism?
So, racism has been an ongoing problem for a very long time. The idea that other races are superior to others had origins from the 19th century. An attempt to prevent racism was the Civil Rights Act of 1964, which made a great impact on America's history as it intended to make racial discrimination illegal, not only in the US, but internationally. And racism is reflected in other countries through the American Medical Association of racially discriminatory practices against African American physicians.
So to help better understand what we talk about in the slides, I'm going to go over some definitions. So we define racism as any prejudice or antagonism directed against a minoritized person, and bias is favoring one thing or person, leading to prejudices and unfairness.
And we define discrimination as treating one thing or person unfairly based on different categories, such as race. And we define microaggressions as derogatory behavior toward a minoritized person that may be intentional or unintentional.
And the overarching intent of racism is to make a marginalized person or group of people feel inferior to one another or another more powerful group. So the goal of this presentation is to provide college students who are preparing to enter the workforce an important understanding of the discrimination many face and ways we can combat racism and discrimination within the workforce.
So we see racism take place in the workplace through unemployment, biases, pay gap, microaggressions, and cultural appropriation.
And one of the first biggest things we see is unemployment. Black individuals face the highest unemployment rate compared to individuals of any other race in the United States. That's 15% over the last decade, more than any other race. This is due largely to racial discrimination when employers either consciously or subconsciously choose to not employ an individual based off the color of their skin instead of their qualifications.
So because of racial discrimination, Black, Indigenous, and people of color who gain employment face a pay gap where they're typically paid substantially less than non-Black, Indigenous, and people of color individuals. So a pay scale analysis of 1.8 million employees revealed that on average, Black men earned 87 cents for every dollar a white man earned, and Hispanic workers only made 91 cents for every dollar.
Overall, employers typically make decisions in the workplace with different biases, which affect their ability to make a clear decision instead of leading them to believe stereotypes about a person based on their physical characteristics or mannerisms. An area where racism often occurs is the healthcare system. Regarding healthcare, Black and Latino physicians had difficulties getting hospital privileges if their practices were mostly on patients of color, forcing them to work extra hard to advocate for their patients and healthcare needs, according to a qualitative study. In addition, Black physicians felt they had to work harder than their white colleague physicians to overcome opinions like not being qualified or being hired for minority status and not their skills and abilities, many times due to racial biases, according to many qualitative and quantitative studies. Although there's a lot of statistics and data on discrimination, they aren't always accurate. Individuals can hold certain racist beliefs or biases, but not do certain things that would directly be considered racial discrimination. This makes it harder to identify biases and makes room for more excuses on why racial discrimination occurs in the workplace.
This also contributes to the presence of microaggressions and cultural appropriation that's present in the workplace. Microaggressions, as previously stated, are derogatory behavior toward a minoritized person that may be intentional or unintentional. Microaggressions are pretty much the stings and barbs in regular conversation, and it's usually seen as mixing up names of people with the same race, singling out employees by race, associating status or competency with race, and like I said before, it takes on a conversational tone, and it can be things such as asking a minoritized employee how they got their job, or requesting a white supervisor, or calling minoritized people so articulate or refer to a minoritized person as you people.
And there are a few ways where we see cultural appropriation taking place in the workplace. A big one is in the fashion industry. As you can see with this image on the left, this was a Victoria's Secret fashion show where some of the models were wearing Native American headdresses. These headdresses are sacred to Native American culture and their way of life. And unfortunately, it was used to make a fashion statement. This did not go over well. But it did hurt a lot of feelings of people a part of Native American culture. And another example would be this Gucci show where they started selling turbans, and this offended a lot of people, especially Sikhs, who used turbans as a cultural and religious practice, and instead it was used to appropriate their culture for financial gain in the fashion industry.
So racism today and resolutions, some contemporary examples are in 2012, 16 Coca-Cola employees made accusations about facing racial discrimination often in the workplace. They claimed they had less opportunity for advancement than their white coworkers and were called racial slurs on more than one occasion. Another example was in 2013, a study found that 78% of Asian Americans who agreed to participate in the study reported that they had been victims of at least one microaggression over a 2-week period.
2016 study showed that work-related microaggressions led to lowered job satisfaction, causing detachment coping, the effects of which are detrimental to the work establishment and employee. So for this study in particular, there was 75 African-American educators who worked in higher education and secondary education, and they were asked to fill out 2 questionnaires. One asked how often they experienced microaggressions, and one had them rate their job satisfaction and their ways of coping. And in this case, those who had faced more instances of microaggressions had lower job satisfaction, performance, and advancement.
So the biggest question that we can ask when talking about racism in the workplace is how to go about resolving these issues and create a more equitable and equal place to work. So being able to have an open and honest discussion with your employer and coworkers on how to create a safe space or environment for yourself and others is very important. A lot of people are well-intentioned and just don't know what they're doing can be offensive to others. So being able to talk about it and really explain how you would feel safe in the workplace is extremely important. Another one is to expand diversity training in the workplace. So this would go along with teaching people how to create that safe environment, what to do, what not to do, and how to make sure that everybody feels included in the workplace.
And racism often occurs in the healthcare system. Recent studies say that patient confidence and trust among patients of color help reduce health disparities in more racially diverse and representative healthcare. And another resolution to racism in the workplace is being conscious of stereotypes and unlearning them, meaning that people should learn and understand how stereotyping contributes to racism in the workplace, and that they should prevent these ideas and situations. A way to do this is by consciously disassociating race from performance and competency. And this is our presentation for racism in the workplace.
Thank you.